hinge guide has been removed, the fixation base is seated. We know it's anchored really well
Yes.
because of the technique of pinning. And the next step is to remove the teeth, score the bone, flatten down everything to the fixation base. And I'll mention, Thomas has done many, hundreds of these, but I always know in Thomas's wake that there are techniques that doctors picked up, and
Sure.
one of them, and because I go in your wake because I go and do some surgeries after you do, scoring the bone,
Right.
and way to relieve the tension
Right.
prior to extractions
Right.
to preserve the buccal plate.
Exactly.
Can you
So,
tell
so
us a
the,
little
so
bit
the
more
buckle,
about that?
so the buccal plate basically is where we're going to place the implants. In your three surfaces. So if we lose the buccal plate, then obviously we lose the surface in
Right.
that thing. So a way that we could do this is to just take a straight handpiece, or you contour angle with a 557 new, and just use the bar as a reference, and just go and score the bone on that line, on that bar line.
Deep score or simple score?
So deep score meaning you're going to go and score. If you go deep score, you're going to cut into the roots of the teeth. But you're going to score the bone to break that surface tension. And then what we do too now is that we actually go interproximal and score up and down, so that you're releasing the pressure on the PDL between the teeth. Okay.
So you're going around a little bit around the CEJ.
CEJ.
Between the
No.
teeth?
We just go straight across the bar.
Okay. Yep.
To score the bone.
Yep.
And then what we do next is that we'll score up and down
I see.
and release the tension on the PDL.
Gotcha.
If you actually go and break the contact, then you can and you grab your
tooth
tooth,
can rotate.
then your tooth can rotate and you can get it out of the socket.
Does that seem like a lot of work to do all that?
No, it's quick.
If you got a new burr.
It's quick, absolutely. It's quick. It's easy.
It's like a fast interproximal tooth prep.
Yeah, and what I've seen is that the doctors struggle, sometimes to keep the teeth out, not to break the buccal plate,
Right.
and that takes a long time.
Long time.
So
Too long.
another tip is just to kind of section your molars because of your root areas, and cut it at the CEJ and section the tooth.
Gives you the rotation.
Yep, and section the tooth.
a
And
great
there's
idea.
kind of lots of ways to take the teeth out, but that's what I've seen most of the doctors do.
Now, I've seen you lately with a. It's a reciprocating. What is that? What is
saw.
that little tool?
The saw? Are you
Well,
talking
it's
about that?
it's almost like a disc.
Oh yes. So the messenger has we carry that with us.
Yeah.
And rope, we have it on our website.
I haven't
And
been.
the-
I haven't
and
been
the
lucky
outside
enough to
shop.
take it with me.
So what we do is that we kind of especially on the mandible, we will use this cutting disc and section the bone after you just and a lot of doctors has asked me, I'm just going to cut the roots with the teeth
I was
in
gonna
one
ask,
piece.
right.
You can do that too,
yeah.
which
Because-
makes it a lot easier.
Especially
after.
if you're looking on a surgery mat and you're like, where is my bone reduction line? Well, right here, it's just above a root tip.
Exactly.
So if you're sectioning right across
That whole thing apart.
and then you can just take the tips out.
Exactly. And I see it a lot with oral surgeons, and I've had some GPs do it as well.
Yeah.
So they love it because it's like one piece, boom, out,
Quick.
and it's done. It's quick.
Yeah. And you can't violate a buccal plate if you're sawing.
Exactly. So another thing is just before you do that is just to release the palatal in the tissue around the teeth, and then on the lingual to do a soft release using a 4x4 or a 2x2.
Gotcha.
So
So
those
a lot
are
of
the-
it is just
yeah.
involved when a doctor does these cases,
Absolutely.
whether you're going to use Rangiers, a burr, a saw, whatever it is,
Right.
tool of choice. There's all kinds of ways to do it, but
Right.
there's fast ways.
There's fast ways, and,
Yeah.
and the doctors that do this continuously on a regular basis kind of gain that skill set, and when you see them, you're like, hey, why are you doing that? And then they
Right.
show you, and
Right.
it's like, makes total sense.
Right, makes total sense.
And they do it over and over
Yeah.
again.
Yeah. Good.
Right, so now your bone is reduced.
Yep. Which
We're going
is-
to go to the reduction model now, and put this on there. So obviously all this stuff comes in your chrome kit, so you can play with it before without breaking anything.
So the goal is to make it flat to the metal, and you can do that. You can see that visually. Down the metal all the way through the bone. And the number one place that bone is under reduced is on the lingual.
Yeah, it's on your palatal, on the maxilla,
You're
obviously
like
on
a
this
ramp of
palatal.
bone.
So when you're coming in, you're kind of reducing the bone, but always on the palatal here, interproximal between 8 and 9. There's usually, and then on the posterior, right back here is usually an area.
It's
that
every
it's
time.
inevitable
Yeah, and
that
if
this
you're-
happens.
If you're aware of it, it's a lot easier
Right.
to do it from the
Right.
first time. But then what we'll do is, this is our kind of a check, is that once you think the bone is reduced down to where you want it, you take the carrier guide and you place the carrier guide and you just seat it on the fixation base. And if it fits without a rock, then you know you've reduced enough. If it doesn't, then you can usually see through the holes somewhere in here where it's impinging on the bone, remove it, adjust the bone until you have a passive seat.
Right.
That's how we check it.
Then another important thing that I see all the time
Oh yeah.
is because I fit the osteotomy guide as well. And if you look down on the patient, on the anterior surface, on the underside of that osteotomy guide, where that last that implant is, it's usually angled.
Like the lowest
And
part
that
of the
at the lowest part of the sleeve.
Yeah.
And that usually hits your bone
If you've not reduced
if you
enough.
haven't
Yeah.
reduced that. So just take a PeriProbe, run it through there, make
Right.
sure that you have room through there because the guide might not seat fully. You could push it down and force it, but that's an easy way to do it. Once this is done, you're ready to go and place your implants.
And we got ahead of ourselves, didn't we? Yeah, bone
Yeah.
reduction, extraction, went right into osteotomy. Well, that's okay.
Right, that's it.
So subscribe to our channel, and then we'll see you at the next video about the osteotomy
Absolutely.
guide and the tips. Okay.